Hi, good evening, everyone. This is Tally, editor for First Year for the USMLE Step 1. Welcome to tonight's webinar, Pathology 250. So again, I'm based at the University of Louisville, where I'm an associate clinical professor of allergy immunology. But again, folks know me better as the editor-in-chief for First Year for the USMLE Step 1. We've got some fantastic folks who are going to be working with us tonight, who are going to help answer your questions. So I want to introduce them very quickly. The first one is Manaver. Manaver, would you like to introduce yourself?
Sure. Hi, everybody. I'm Manaver. I manage the Step 2 product here at USMLE-Rx, as well as the Faculty Council. I'm very excited to be here tonight, and I look forward to answering your questions.
Great. And our other panelist tonight is Sean. Sean.
Hey, everybody. Sean Nanji here. Just wanted to say hello. Always looking forward to these webinars, and I look forward to answering your questions.
Great. And then on top of that, we have a great support team, Jeff, Katie, and Kate and Louise, who will also be answering other types of questions as we go on. And so there is a Q&A panel where you can ask questions. If you're on a PC or a Mac, it's on the right-hand side of your screen, and you can of course put in your questions there, and Sean and Manaver will try to answer your questions, as well as Jeff, Kate, and Louise where appropriate. And then at the very end, we'll open it up for more Q&A as well too. All right, so I'm going to get going. So the first word in first aid is relax. It's been the first word for 29 years. As we go into our 30th edition, it'll be the first word again. And the point here with the word relax is that we want you to take the long view in terms of planning for the USMLE Step 1. It's not something that obviously you take lightly. It's not something that you just jump right into. And so, we want you to be very deliberate and intentional in planning for this exam. So that's why we want you to relax first, and that will help declutter your mind as you think about how you want to prepare for the exam and what you want to get out of this experience. And we'll cover all that during this discussion. All right, so this is just a quick overview of the agenda here. We're going to be talking about the step one basics, how you define your goal, timelines for studies, how do you approach each of the subjects, choosing prep resources, some additional advice that have kind of stood the test of time. We're going to talk about the bricks a little later on. We're really excited about this as a learning resource. And then at the end, we do have a raffle and a really, really special Halloween offer for you guys. So please hang in there, and maybe you'll win something as well too. And then, as I mentioned, we'll have some Q&A at the very end. And as I mentioned, as we go along, feel free to ask questions of Sean and Manaver with regards to exam preparation. All right, so I'm going to start off with a poll first. I want to see who's out there. We got lots and lots of folks out there tonight, so I'm going to try to find out who you are. So you should see a question opening up on your screen, and please choose an answer. It'll take a little while for the poll to get out there, but once it's out there, then you can then submit a response. I'll leave it open so that we can get at least 50 to 60% of the folks who are responding. It does take a couple of seconds for your response to get in and for the results to be tabulated. So we'll give it a minute here. All right, we are over 50%. I'm going to wait a little bit longer. Let me see if I can get it 75%. Do you really want to know who's out there tonight? Okay, I'm going to go ahead and close the poll, and I'm going to share the results here. And what you can see here is that roughly half the folks that are coming out from outside the United States. You may be in the U.S., but you originate from outside the United States. We also have a fair number of U.S. medical students, both allopathic and osteopathic, as well as U.S.-born international medical students as well too. So welcome everybody. We've got a really diverse crowd tonight. I'm going to ask another question, which is, when do you plan to take the step 1? So it could be now. It could be in the near future or beyond. So choose a response, and then we'll share the results with everyone. All right, looks like about 25% of you folks have voted. Keep it coming. Keep it coming. It may take a little while for the results to come in, so keep keep patient. Oh, here we go. We're up at about 80%. So let me close that and share the responses here. And what we see is a big spread. It looks like the majority of folks are going to be taking the exam next year, anywhere from January and beyond. The peak is in April, June, which is the classic board season, whether you are a U.S. student or an international medical graduate or an international medical student. But there's a big distribution throughout the year. All right, let's continue with the discussion here. All right, so the exam is a one-day test, 8 hours in total, and there are 280 questions in 7 one-hour blocks, so that means 40 questions per block. You do get a minimum of 45 minutes of break time, and in terms of how the exam is set up, you do have an orientation block. You are given 15 minutes for that orientation block. If you skip that block, or if you just go into that block to adjust the audio settings on your headphones for the very limited number of multimedia activities, you can actually get to 15 minutes of additional time. In addition, if you finish any of these 1 hour blocks ahead of the allotted time that you're given, the allotted 60 minutes, then whatever time you have left over then also goes to your break time as well too. As you can see, somewhere in the middle, you'll take lunch breaks, that type of stuff. Now, on the USMLE, there's only one type of question. That is the single best answer. As I mentioned, there's a handful of questions that have multimedia on them. And most of the exam is composed of, clinical case vignettes with multi-step reasoning. And so what it means is that they'll often have multiple different types of disciplines or organ systems combined together. So it may start off as a biochem question or with pathophysiology, and then pivot to, hey, now how do you treat this, right? So here's an example of a simpler 2-step question. So a 32-year-old Caucasian woman presents with a 5-day history of occasional double vision and bilateral ptosis. Then it goes on to ask, what is the most appropriate diagnostic test? And so right away, when you look at this, you can gather that this is not just a 1-step question, right? You got to figure out what's going on with this woman. So based on this clinical presentation, you kind of come up with what's the most likely diagnosis, right? And so in this particular case with a young Caucasian woman who has bilateral symmetric ptosis and the double vision, you're mostly likely dealing with something like myasthenia gravis. You could argue for something like multiple sclerosis, but the findings tend to be more unilateral, and there's a tendency for that to more often occur in African American women, though Caucasian women is obviously quite common as well too. So to get to the diagnostic test, you have to first come up with what you think that the provisional diagnosis is, and in this particular case, the most appropriate diagnostic test for myasthenia gravis is going to be something like edrothonium, short-acting edrothonium, more popularly known as the tensilon test. It is being supplanted in the United States and presumably around the world by anti-acetylcholinesterase antibody assays. But again, that's just an example of how you can have a 2-step question. And I would say on the USMLE Step 1, a fair chunk is 1-step questions. You got a larger chunk of 2-step questions, and then a smaller number of 3-step questions and beyond. All right, so on the USMLE, the interface is you'll see the interface that's quite straightforward. At the Prometric Test Center, and you can see here's a question, and what I'm circling here is the clinical case, or also known as the STEM. And then here's the actual question, which is the most following is most likely diagnosis, and that's called the lead-in. Then it's followed by the distractors. It's a minimum of 4, but the majority of the time you'll see 5, and then occasionally you'll see 6 or 7, answer choices. And about 15 to 20% of the time, you're going to have some sort of visual information, such as some microhistographs, gross anatomy, imaging, X-rays, and so forth. And then you can see here there's navigation across the top and the side, and then the all-important timer is at the bottom. When you are ready to exit the exam, you can just click here. Now remember, when you exit the exam, you can no longer go back when you exit the block. I'm sorry, one of your 7 blocks. You can no longer re-enter that block to change any of the answers. So until you exit the block, you can of course change any of the answers over here. The other thing you can do is you can lock the exam, but the timer will continue to run. If you're going for a pre-break, and so just keep that in mind. You can go for a pre-break anytime you want, but if you're doing it in the middle of a block, then the timer keeps running. So it's best, obviously, to save those bathroom breaks for the time between the blocks. All right, so let's talk about scoring and passing. All right, so this is what everybody's really interested in. So the passing is 194 on a 3-digit scale score. It's been that way for a couple of years. As you've heard, there's been some rumblings that the exam may go pass-fail. There continue to be some discussions, some preliminary recommendations that perhaps it should. But that being said, there has been no final decisions made. And for the purposes for folks who are taking the exam, in the near term, please presume that it will continue to be a scored exam at 194. So at this point, while while it is interesting stuff that's occurring, we don't believe that it's going to have any impact on most of you. The mean on the exam has been wavering between 229 and 230. It's been inching up and up and up, but it's still been bouncing around the 230-ish, 229 range. Standard deviation is 20 points. For U.S. medical students, you're going to essentially pass mostly on the first try. For IMGs, regardless of whether you were born in the United States or not, the passing rates are lower. It's going to be in the high 70s, low 80s, depending on the cohort and the year and whatnot. But that being said, ultimately, greater than 90% of you will pass within 3 tries. All right, so the USMLE has some percentiles, and so they're updated every year or so. And what you'll notice is that at the proverbial 250, it's around 85th percentile, which is 1 standard deviation above the mean, assuming a normal distribution. And then the 194 is right around here, and as you can see, it's about 6th percentile. But again, it's going to be a little different in terms of percentiles for U.S. medical students versus international medical students and international medical graduates. All right, so in terms of defining your goals, we like to keep it simple in first aid. We talk about passing the exam, so that means passing comfortably. So anywhere between 210 and 229, so up to 1 standard, up to the mean, and then beating the exam, so from the mean all the way up to 1 standard deviation above that, and then ace the exam, which is 1 standard deviation and beyond. And so, the reason why some of us might be thinking about higher scores is if we are keeping certain specialties in mind. And so there's the mnemonic here, Road to Riches, that reminds us that certain very competitive specialties like radiology, radiation oncology, the surgical subspecialties, orthopedics, ophthalmology, otorhinology, urology, plastics, and dermatology, they often use the USMLE as a screening tool. It wasn't really designed to be that way. It's just how it worked out, and so there's a possibility of that happening in those competitive specialties. And so here's some data that lends a little bit of support here. This is data coming from the NRMP, Charting Outcomes in the Match publications. And excuse me. And what you see here is that on the right side, or on the left side, are the big specialties like family medicine, psychiatry, pediatrics, internal medicine, which is what I did. And then on the right side, and you can see the rising scores. You got vascular surgery, radiology, interventional radiology, ophthalmology, orthopedics, the surgical subspecialties, and so forth, right? And these are again the average. These are the average scores for the U.S. medical students that are entering those specialties. Now, before you get too fixated on this, I want to show you this older graph from the NRMP again, and what it really means for the majority of us that are going into the big specialties like internal medicine and pediatrics and OBGYN and so forth. So again, if you are a U.S. medical student and you're going into one of those big specialties, even if you fail the boards, and this is an old graph, and so back then pass fail was somewhere around here. Your probability of matching into your preferred specialty, as long as it's not hyper competitive, was still pretty good, 90% or above. Now, if you are a U.S. medical student and you want to go into otolaryngology, which is what my brother did, you can see there is a drop-off response here. But again, even back in the day, as long as you had a 220 or whatnot, and probably 230, you still had a greater than 50% chance of getting into that specialty. But you probably need to think about a backup. If you are an international medical student, whether you were born in the U.S. or whether you were born outside the U.S., the curve is a little flatter along the way, and you can see that it kind of tapers up, at around 80% max, even for folks who do really well on the USMLE Step 1. So that's just the reality. All right, so I have a question for you now that now that I've shared a bunch of data with you. What is your USMLE Step 1 goal? Is it to pass comfortably, 210 to 229, beat the average, 230 to 249, or ace the exam, 250 or above? All right, so I'll leave that here for a couple of seconds, and we'll capture some data. And again, it does take a little bit of time to get all the responses in, so appreciate your patience while we're gathering the data. Looks like right now about 30% of you folks have responded. We'll keep it open for another 10, 15 seconds. Try to get up to 60, 70% here response. All right, good. Looks like we are over 75%. I will go ahead and close the poll and share the responses. And what you can see is that close to 2/3 of you folks wants to do really well, ace the exam, and the rest looks like you guys want to beat the average or pass comfortably. The key thing is there's absolutely no right or wrong answer. 194 gives you a pass, but obviously, as we discussed, there is some correlation with your chances of matching into either a very competitive specialty, and also for IMGs, when you're just trying to match a period. All right, so let me go ahead and hide that and go into timelines for studying. So again, in first aid, we try to keep things very simple here. We talk about a just pass schedule, and again, these are all really rough numbers here, and so really use this as a loose guide here. And so this can a lot of this can be done in your dedicated time period, and most schools will give you, most U.S. schools will give you 6 to 8 weeks to do that, and here we think first aid obviously is a great framework for organizing your study. We'll talk about crammable subjects, what those are, in a little bit, and then you want to do lots of questions, a minimum of 2 question banks. If you are on a gunner schedule, and you might want to do this because obviously you're aiming for that 250, or you're just not historically maybe you're not a great test taker. You may need more time. And again, this is a very loose guide, and it can it can go much greater or even less than that. But in addition to the first 8 high yield facts, there are the less crammable subject areas, and there are there's a recommendation that you do at a minimum 2 and maybe 3 question banks. And again, we'll talk about the science behind why you want to do more versus less questions. All right. In terms of choosing study strategies, you've made it this far, with regards to some of your study habits. You've worked, many of you taken MCAT or exams similar to the MCAT. You've done well on standardized exam, but you also need to keep in mind the structure and characteristics of the subject. So, for example, microbiology and pharmacology often works well in terms of tables or flashcards because it tends to be highly structured, information and knowledge. Whereas something like physiology is all about relationships and so forth. So sometimes you have to create these mind maps and these interconnecting diagrams in terms of figuring out what's going on. You also need to understand the structure and characteristics, strengths and weaknesses of your curriculum, right? So it's common sense if microbiology is not well covered in your curriculum, or just a general weakness in terms of how it's taught, then you're probably going to spend a little bit more time there with resources like Sketchy or whatever, as you are preparing for that particular subject area. And then finally, the other practical consideration is the time that's assigned to a particular subject or system. So if you are, preparing for neuroanatomy, it's a very small part of the exam, so you probably only get to spend a day or 2 on that in terms of any type of dedicated studying. And then, so that means you're going to be very limited to, maybe a high yield review book, lots of questions, some flashcards, that type of stuff. Whereas if you're doing something like pathology, then you can be doing all kinds of stuff. You can be doing all kinds of review resources, videos, this, that, and the other, in preparation for that. All right. So the next 5 to 10 minutes, I'm going to go through fairly quickly because all this is on my blog, my website, firstaidteam.com. I'll show you where that is later. And so, there's obviously a lot of details. I don't expect you to take this down, but I'm going to hit on the highlights and I'm going to hit on the themes here as we go through, what's high yield and all these various disciplines. So, anatomy is generally considered, gross anatomy is generally considered low yield, but what is high yield on the exam is anything that has a specific clinical correlation, where it's a traumatic injury, procedure, common surgery. So, if you have a spiral fracture of the humerus and they ask you about, hey, what might be the motor and sensory deficit, then you might think about, hey, what's the innervation? What's that nerve that runs through the humeral groove? And then what happens if that nerve is severed? Some of the subdomains in neuroanatomy, such as neuroanatomy embryo, can be high yield because there's a lot of clinical vignettes that can create it off this stuff, but it's going to be limited anyway. So you're going to try to, again, you're going to try to be very focused with your study. Cross-sectional anatomy does show up on the USMLE, but it's going to show up, as X-rays, CTs, MRIs, whatnot, and the histology and so forth is going to show up as photomicrographs and so forth. And so you have to be able to identify the structures and the pathology, from clinical imaging. All right, biochemistry is crammable. It's one of those crammable subjects, and and particularly what tends to be high yield there tends to be the metabolic pathways, vitamin deficiencies, any disorder that involves genetics, mutation and whatnot, and also metabolic, as I mentioned, metabolic pathways, and understanding the key regulatory enzymes and substrates. And so that's where you hear a little bit about pathobiochemistry. And on the science side, in terms of hey, what are the basic laboratory techniques for testing hypotheses and so forth. You're going to have to be able to interpret ELISAs, Western blots, Southern blots, RT-PCR, and those types of understand what those things are, what questions can they be used to answer, and if you're presented with that data, how do you interpret it? Because that's the type of stuff that you'll have to do in the future when you review the literature, even if it's in JAMA, New England Journal of Medicine, or whatever your specialty journal is. Microbiology is also one of those crammable subjects. And here it's, the key takeaway is that it's not about just the bacteriology. It's so much more. And when you're thinking about the various bugs, it tends to be crammable because they often ask again about how do you identify the bug in the laboratory or make the diagnosis, target orders, how does it get there, the vectors and the reservoirs, the treatments, and so forth. On the clinical immunology side, it's putting the immune response into clinical context, right? So how does it naturally evolve? How can it be manipulated by vaccines? And what happens if you have a disorder of the immune system, like immunodeficiency, which often highlights what happens when you have B cells or T cells or macrophage deficiency or natural killer cell deficiency and whatnot. All right, pathology is a big topic, and a lot of you folks are going to have been or already been really working on that because it's obviously a major part of your curriculum, right? And so the big thing here in terms of how the USMLE intends to approach pathology, pathophysiology is that for the most of the diseases, they're going to really stick with the hallmark characteristics, except if it's something really big like asthma or diabetes or heart failure. You often see variants in different presentations, but if it's a rare disorder, like Bruton's gamma globulinemia or something like that, it's going to have more classical presentations. The patient itself will often provide some clues, so their age, gender, ethnicity, keep it all in context, right? Because there's not that many things that are pathognomonic, but they will often skew, the presentation is classic for this in African American or this, that, and the other. Then then that should go along with it. They will, it's generally considered a no-no to put a red herring on the test. Red herring just simply means that they should not be trying to, purposefully mislead you. Buzzwords, trigger words, obviously we use those in first aid, and you'll see those in other high-yield resources, but as you know, we're using them as memory triggers and ways to make it colorful and descriptive and so forth. But on the exam, you have to know actually, how they're going to clinically describe that particular finding. Pathology, does often come with those gross specimens and photomicrographs, as well as very limited multimedia like videos or lung sounds or a patient that's walking and you're trying to identify the gait disorder and whatnot. But the nice thing here is that we have found from our experience and from authors that have worked with is that a lot of times the questions can be answered by the history alone in the STEM without actually having to look at the image. And a lot of times you're just using the image or the video as confirmatory information. All right, pharmacology is crammable, again, because they're asking about a lot of the same things, like mechanisms of actions, clinical uses, adverse effects, drug-drug interactions. You do want to at least start with the protodrug drugs and learn the major variants. If you want to, if you really want to gun for that 250, then you're going to have to learn all the minor variants, but you will never need to learn the trade names or dosages unless it just helps you in terms of better scaffolding, a better memory palace, and so forth. These are the major categories. I won't read them out, but all these things are covered in first aid. And again, because it's about treatment and management, it's almost always going to be in some sort of case-based question or scenario-based question integrated with other disciplines. Physiology, as I mentioned, is concept-oriented. So, so diagrams, as I mentioned, tend to work really well in terms of really understanding the relationships, like, the pituitary, adrenal axis and all that type of stuff. And again, you're mostly going to see it with physiology, pathophysiology, and in the context of case vignettes. All right, psychiatry includes a whole set of related fields, including psychology, social sciences, psychopharmacology. We tend to think about the mood disorders, but there's all kinds of other high yield subject areas, which again are covered in first aid. All right, public health. Traditionally, this has included biostats, epi, ethics, and so forth. But in the last couple of years, they have been putting in population health, health system science. That includes healthcare delivery, patient safety, and quality improvement. Biostats and epi, that's where numbers and understanding likelihood ratios and positive predictive value, and when would you want to use a cohort study? When would you want to use a case control study? Those are the classic things that are there. All right, so that was a whirlwind tour, and as I mentioned, all this is on my blog. I'll show you where you can get access to these slides, that have all the details. Next, I'm going to just talk about review resources. And so, here's the thing: there are tons of review resources out there. There are, books like First Aid, Q-banks like USMLE-Rx, self-test reviews, review books, case-based books, review courses like Kaplan, all kinds of multimedia video apps and mobile apps and digital flashcards like First Aid Flash Facts and so forth. So, there are literally hundreds of things out there, and you have to understand that when you're evaluating these review resources, you've got two major limitations. One, you don't have all the money in the world, but actually probably even more important, you don't have all the time in the world, right? So you have to be selective about what you use and not try to just buy everything under the sun. So what are a couple of rules out there? So a couple of things that we strongly advise you to do. One is check out the book reviews in First Aid for the USMLE Step 1. Now, even if you're not using the latest edition, I strongly urge you to go to our blog at firstaidteam.com. We do actually have detailed reviews that we put on our blog that as a community service, because there's not enough space in the book where you can read up on what's the best that's out there, and use that as a guide. It's obviously, not everything works for everyone, but you can use that as a general guide in terms of evaluating and selecting resources. Once you decide what you want to do, you want to start using those things early as part of your curriculum as you can. So we strongly urge that you use First Aid as part of your curriculum. If you're using USMLE-Rx, use it along with your courses and so forth. So do QMAX questions as you are going through your courses. That being said, try to be prudent about what you think you can use. Know your limitations. The good news is that most of these resources are on demand. You can either subscribe to them digitally, or you're getting them from Amazon and it'll be there in 48 hours, 2-day prime shipping or whatever. So you don't have to overbuy anymore. And certainly, make sure you're not buying because, buying something just because you're using it as a psychological crutch, just because it'll make you feel better. Also, when you're looking at series, like a book series or resource series, not everything in the resource series is of the same quality or fits the various subject areas, so just keep that in mind. All right, so got a couple more questions as we round into the home stretch here. So first of all, I want to know what resources are you likely to use? It could be some of the resources or all the resources or none of the resources, but I presume you're going to at least use one or two of these things. So question bank, review book, flashcards, mobile apps, videos, what are you going to be doing? Take a pick here. So looks like we've got about 15%. So I'm going to leave this open because this takes a little longer to tabulate the resources. This will probably take a good additional 20 to 30 seconds. So I'll pause there while we tabulate the results. All right, we are at about 50%. Keep it coming. Keep it coming. All right, we are now at around nearly 70%. I'll wait a couple more seconds. Hoping to get up to 75%. This is something important that I think a lot of you guys would be interested in terms of the information. Okay, let me go ahead and close and share the results here. As you can see here, almost everybody uses question banks and review books and videos. And then, also popular are flashcards, and a lot of people are using mobile apps as well too, but not as much. All right, I'm going to have one follow-up question. So another resource that some people are using is tutoring. And so, so are you using any tutoring, or have you tutored, or are you thinking about using tutoring or coaching services or whatnot? So go ahead and answer. We'll leave that open for about 30 seconds. Gather some data that way. All right, looks like about 20% have responded. All right, 50%. I'll just wait a couple more seconds. All right, great. I think we've gotten a good response rate here, about 70%. So I'll go ahead and shut the poll and share. And it looks like about 25% of you folks might be doing some tutoring, or will be doing some tutoring or whatnot. So again, it's something that's we're seeing more commonly. So again, another resource to consider as well too. All right, so let me go ahead and I'm sorry, I don't think I ever shared the results. There you go. And you can see 14% do it through their med school, 7% will do some sort of private tutoring, and 5% with an independent tutor. I guess somebody who's just out there. All right, great. Okay, great. So some additional study advice here, and I'll open up to some comments in just a little bit here. But with regards to some general advice, there's a couple rules that students and international medical students and IMGs have found really helpful. One is you want to plan well ahead of time, as I mentioned, when we talked about relaxing. So establishing a study schedule, and that means sitting down with students or IMGs that have gone ahead of you. What did they do? Reading about them, reading about it, their experiences on studentdoctor.net, and read. But of course, try not to get too stressed out, because people can psych each other out on these various bulletin boards and social media. But if you schedule wisely, if you don't, and if you do a couple of things like make sure you don't overschedule, where you allow time for breaks and exercises. I recommend that even during your dedicated time off, you take off at least one day, ideally for just to be a human being. You might do a little bit of study, you might do a little bit of catch up, but really, make sure you take a walk, go for a movie, spend time with that significant other of yours, or spend time with family. That is actually re-energizing. That actually prevents burnout. We do have a checklist that helps you plan in first aid. It's right at the beginning of section 1, right before section 1. We talked about staying relaxed and grounded. And also, if you save the crammable subjects for the very end, because as we all know, while you don't want to cram, you will end up doing some cramming towards the very end. You might as well leave those subjects towards the very end. If you do that, you probably won't have to rejigger your study schedule too much. A couple other things that you want to think about as you study is integrate and apply everything. The answer always becomes, or the question that you need to think about is that how do these concepts relate to each other? How does that pathophysiology fact, how does small airways relate, small airways anatomy relate to asthma, airway constriction? How does albuterol relate to small airways? That type of stuff, and be able to apply all that. The other thing to think about is that you have gone to med school, or you are going to med school, so you inevitably have learned some high yield stuff there that's been confirmed by high yield resources. such as first aid. And so you want to focus on that before you go to anything else. Relearning stuff that you already know is actually the highest yield way to learn. And hopefully, like I said, they've done a good job in med school, and all you're having to do is review. But occasionally you do have to learn new things, but save that for later. I'm going to pause here and see if Sean and Manaver or anybody else have any thoughts to share.
Tal, we've received several questions where students are asking about the NBMEs, which NBMEs to take and when.
Yeah, I'll actually address that in a little bit. There's a whole number of exam resources. So if you don't mind, let's hold on to that question for a couple of slides. Any other general advice here? Okay.
I think you've covered it. Yep.
Okay, very good. Well, we'll get to that NBME thing in just a little bit. All right, so let's go on to computer-based testing. So, the computer-based testing, there's a tutorial you can use, and and again, if you do that ahead of time, you can skip that tutorial that they give you 15 minutes at the front of the exam. There are keyboard shortcuts. Most people don't use them, but if you're really fast with the keyboard, you can consider that. And also, you want to use computerized tests. These days, it's mostly computerized tests. There are some question books out there and whatnot, but you're going to get the most bang for the buck just doing computerized tests and whatnot. But if you're international and you're having, there's a you might be running to some of these paper-based exam. In terms of self-testing with USMLE style questions, it's important to be doing it throughout your studying and especially towards the end. And there's actually a lot of science behind that. And a major study was published several years ago in the journal Science, where they basically looked at college students studying science material and then being tested a week later, and this was published in the New York Times. What they showed is that you can actually learn through just self-testing. So testing just isn't for assessing yourself; it's also for actual learning. And so what they found that if you were self-testing yourself, like doing questions, you do better than if you were just studying it, reading through the material once, doing it multiple times in the same time frame, or doing concept mapping. And again, every study, every arm of this trial, all the students had equal time, so nobody was advantaged over anybody else. But people who self-tested did better. And even the questions were more challenging. They were more inferential questions. Again, people who did retrieval practice did better. So, and as a matter of fact, when we've asked students, if they were going to do anything differently, the one thing they would have done differently would perhaps be more questions. All right, so let's talk about all those computer-based practice options, including the NBME forms, right? So good news, some of the stuff's free, right? The USMLE sample test, 120 or so items that you get with the orientation materials that you download is useful for format familiarity. But unfortunately, some of the items are a little old, and there's some variation in terms of their quality. As Manaver mentioned, some of you guys had questions about NBME CBSSA. That stands for the Comprehensive Basic Science Self-Assessment. You go to nbme.org. And you can purchase access for them. They range anywhere from 40 to 70 bucks, depending on the level of in terms of feedback that you're getting. And it's useful for benchmarking because it does have some predictability. It does have some predictive power in terms of outcomes on the USMLE. I know we're up to like forms 20 through 24 are like roughly the latest, I believe, that are out there. And so just a couple of general advice. They do retire some of the earlier forms, so you're better off using the latest forms. And what I would say is that if you know that you're generally better off using the latest form, like form 24, and then working backwards. Well, sorry, well, let me put that another way. If you know that you're only going to be using 3 forms, then I would consider something like, hey, do 20 forms 22, 23, 24, whatnot. If you know you're using 4 forms, then you can start with 21, that type of stuff. With the forms, I would usually space them a couple of weeks apart, because you need a couple of weeks between them to be able to adjust. You're going to get a histogram in terms of your performance, where you're doing well, where you're doing not so well. And I would not, and in terms of when you stop doing the forms, I would say I wouldn't do a form any closer than 1 week before the boards, because you won't have any time to adjust again, for the based on the histogram strengths and weaknesses that they show you. And again, I would say most of the forms, towards the dedicated, time period. So in the last, couple of months, you can use a form early on if you know that you can burn one early on, if you know that you're going to be doing this 3 months and that type of stuff. But there's a couple of places you can do that. You can be using, USMLE-Rx or other QBanks or UWorld or whatnot. As you know, we just launched our own self-assessment about a month ago, and we have another one in the works. Hopefully it'll be released in a couple of months. UWorld has a couple of self-assessments as well too. And also in USMLE-Rx, you can actually, from the main bank, you can create your own half-day simulation, full-day simulation. So it's your own mini self-assessment that you can use. And and particularly we can speak to our stuff. If you do a self-assessment or simulation, we will give you a predicted score, and we can get within 20 points most of the time of your actual final predicted score if it's close to the actual exam. All right. So let's talk a little bit more about research about self-testing and retrieval practice, what works and what doesn't. So there are some nuances to this. So what kind of questions, should you do? Well, not a shocker. QBanks are more effective at getting a higher score than flashcards. You have to do way more flashcards to get the same score. So that's one. Flashcards are still helpful, and they're not as mentally intense, but they don't look like anything like a USMLE question. So you need to practice with things that feel like the real thing. In terms of how many questions, how effective are they? The estimates are vary a bit, but they range anywhere between doing 300 questions to 450 questions, and obviously the lower the number, the more effective to get a point on the step 1 adjusting for GPA MCAT. We're proud to say that with USMLE-Rx, we just did a study where we actually did the full analysis, and in our study, students only had to do 265 questions to get 1 additional point on the USMLE, controlling for GPA and MCAT. So that's pretty high yield. So if you do all the questions in USMLE-Rx and the self-assessment, on average, you should be doing 10 points better on the exam after adjusting for MCAT and GPA. In terms of how many questions you need to do, we haven't seen any study that has actually defined a ceiling. There's a study from University of Michigan where they basically said, hey, look, anybody doing more than 3,200 questions, USMLE style questions, have the better performance. And by the way, it's unique questions, as opposed to repeat questions. So it's not just doing UWorld twice, for example. And as a matter of fact, in the Michigan study, they found that it had to be unique questions. And in fact, repeating the MCQs, while it may be good for general learning, it didn't get you a higher score on the USMLE at all, surprisingly. The last thing that they found, again, out of the Michigan study, University of Michigan study in the Journal of Academic Medicine, was that students who did 3 passes through first aid did better than students who did not. And again, they did it. We had no involvement with that study. All right. So just some general advice, on test day. You're going to be really jacked up that day. It's natural. So think about how much coffee or tea you drink that day. You're going to be in a office building. A lot of you have taken prometric tests, in the past, or similar places in office building. A lot of time it tends to be really cold, but you never know. The sun may be on your side of the building, may make it warm. So come in with very comfortable layered clothing so you can adjust during the day. Sweatshirt, sweatpants. This is all about comfort. This is not about fashion. Some of the questions may be a little chunky. So if you run into something that's really long, think about looking at the lead-in, which is the question. So, hey, what's the most likely diagnosis, or what's the most appropriate treatment before you go back? And you can then skim the distractors or choices, and then go back and work your way through the stem or the case. In terms of managing the clock, you've got 40 questions in 60 minutes, right? So that divides into 90 seconds per question. My general rule of thumb, is that you try to commit to an answer within 70 to 75 seconds, regardless of whether you think you got it right or not. All right. And so you mark it, and if you think it's solvable, go ahead and mark it. There's a box on the interface where you can mark it, so you can come back to it later on. But don't mark too many. Try not to mark more than 8 or 10, because you won't be able to solve that many. Because when you get in, even if you have 10 to 12 minutes, those 12 minutes will fly. When you're trying to go back and work on some of those tough questions. In terms of food and so forth, obviously you're going to be eating light. You're going to be mostly snacking. You're going to be running on adrenaline. There's no right way to do it. So a lot of folks do 2 blocks, a break in the snack, 2 blocks, a break in the snack, all the way through. Some people go 3 blocks, then 2 and 2. So it's up to however you want to do it. And again, if you want to learn, or if you want to kind of learn more about what your energy level is during the daytime, you can go to USMLE-Rx. You can, basically set aside, the 280 questions for a full day simulation, run it through like a standard simulation, start at 8 o'clock, and run it, and time yourself. And then you can kind of find out when you need to take those breaks. When I was in med school, we had this joke called the C reflex. In other words, if you run into a question that you have no idea what's going on, and you will run into some of those types of questions, and you cannot narrow it down to, like, say, 3 reasonable choices or whatever, then go ahead and pick your favorite answers. In our study group, we all chose C, and then we would pick that if we had no idea what was going on. A couple of things to keep in mind. These questions are sometimes they put experimental questions or marker questions just to see how, to see if the questions are performing well, or they need some sort of, they're doing some sort of psychometric monitoring of the exam. And again, number 2, like I said, there are going to be some questions that are super hard. Get over it. You've got 279 other questions to deal with. So take your best guess if you don't know what's going on, and move on. At the end of the day, as I mentioned, as long as you pass, you will earn your MD, your DO, your MBBS, and whatnot. Recognize that for IMGs, it'll be a little bit more challenging if the score is on the lower end, but it's still an accomplishment to pass the exam. And hopefully it's a score that you will be satisfied with, and that you can use as part of a competitive residency application. Either in your 3rd or 4th year as a medical student, U.S. medical student, or if you're going through the ECFMG process.